Okay. Hi, do I have your permission to record you for my therapeutic intervention class?
Yes.
Okay, awesome. This is Tom. He is a 38-year-old recreational basketball player, and he reports with Achilles tendon pain in both feet. But his right one is currently giving him more pain than the left. So first, what I'm going to do is I'm going to check his postural assessment. So I'm looking for anything that's like out of the ordinary. So I'm looking for like excessive valgus or varus, anything like that, any compensations, anything like that. So off the top, I can tell that his right foot isn't dorsiflexing like as it should as normal. So that could mean that his hips are compensating, or his shoulders would probably be compensating as well. And then also I'm going to do a movement assessment. So I will just have you do an overhead squat and just go nice and controlled for me. So I'm seeing that his knees are going out and his right foot is it's more in a plantar flex position. And then I can also do a single leg squat test, which we could see if you could try to do it. Just go as far as you can.
Okay.
But I'm checking for any like instability or excessive reliance on his other leg. And then I can also check for his gait analysis. So I'm looking for like any deviation, such as like shortened stride length or over reliance on plantar flexion. So you can just go ahead and walk for me. Yeah, so I'm seeing he's having trouble dorsiflexing that right foot. Okay, and then next we are going to evaluate his range of motion. So I'll just have you sit on this table for me, and then I'll grab my goniometer, and then I'm just going to assess his plantar and dorsiflexion just to get his norm. So I'm going to start on the unaffected side first. So let's see. I remember how to put this part in. Okay, so I'm gonna have you get in 90, and then I'm gonna have you plantar flex. Okay, so on this side it's about 40 degrees, so that's normal. And then go back to 90, and then I'm gonna have you dorsiflex. So this one I have about 11 degrees, which is in the normal as well. And I'm gonna move over to the affected side. Okay, and then I'll have you plantar flex. Oh, okay. This one got to 70 degrees, which is really good. And then I'll have you dorsiflex. And then this one barely moves. I'm getting less than 5 degrees. So we know that is not normal. And then next we are going to do passive range of motion. So I will start on the unaffected side. So have your foot going 90. And then I will just have you, so push toward my hand. Yeah. So try to go down. Okay, and then push on the gas. Okay, and then I'll move over to the affected side, and then I'll have you push on the gas. Okay, and then push against me, and he's having a pain and difficulty with that. And then next we will go to active range of motion. So on the unaffected side, I will have him do it on his own. So just go into plantar flexion and then dorsiflexion. Do that a couple times, slow and controlled. Perfect. And then we'll go over to the affected side. Do the same thing, slow and controlled as best as you can. Having pain with the dorsiflexion.
Yeah.
Okay, gotcha. And then next we are going to evaluate his strength. So we will go to manual muscle testing. Yeah, I'll go to manual muscle testing. Okay, wait, I think I messed that part up. So yeah. I already kind of did manual muscle testing, so that was my bad. So for passive range of motion, it would just pretty much be the same thing, right? Kinda. Yeah, just moving it on your own, kind of. Okay, well, I messed up on that part. It's okay though. Oh, we can also do heel raises too to assess for strength, so you can stand up. And then you can do, just get back a little bit. So you can do double leg first, and just to see if you have pain with that. Is that doing okay?
Yeah.
Okay.
It's just like my impact.
Yeah. Okay. Now go to the unaffected leg first, and you can do heel raises. Good with that. Good with that. And then go to the affected side. And then play with that.
Yeah. It just hurts when I'm writing down.
Okay, gotcha. So for today's treatment, we can do the Grafton technique, and we would do that for 3 to 5 minutes. So first, you want to make sure your hands are clean. You wash your hands. You put on gloves, and then we have cocoa butter here. So you would apply cocoa butter to his Achilles and his calf muscles. And then you also want to make sure you're using long and cross friction strokes, and you also want to make sure you're not doing it directly on the affected area, to do around it. And then also you want to let him know that he should expect mild redness, but there shouldn't be like any bruising or anything like that. And this will overall help with like, it'll increase the rate and amount of blood flow in the area. Or we could also do cupping therapy for 3 to 5 minutes as well. And we would just place the cups on the tight spot. So you could put a few on his calf, but really try to not go directly over the affected spot. And then, so for at home stretches and range of motions, I could have him do a soli stretch. So you could just put your affected foot onto a surface like this and stretch it for like 30 seconds, do 3 times, do each side. And then we could also do banded dorsi and plantar flexion resistance with these bands. So you would grab the band, you'd put it around your foot, and then I would probably do this 10 times, 3 reps. Yes, and you want to make sure it's slow and controlled. And then we could also do eccentric heel drops. So go up, slow down, and you could do that 3 times, or 3 times 12 reps. And then we could also use a foam roller. So you would do this on the ground, and you would just put it, yes, right under your calf muscle, and then, yes, slowly roll back and forth. Yes. And yeah, and then I will have the exercises listed out on the Word doc. Thank you.